So we're going to read another article, or in fact we're going to read a few articles today, and I have noticed that bird flu has been in the news a lot recently. You can see all of these stories here. We'll read the top one from Forbes, but lots of stories on the Daily Mail, Yahoo, all about bird flu being detected in Australia, in Idaho, also about Finland to start bird flu vaccinations for humans next week in world first before any cases found. So they haven't found any cases of bird flu, but they will be vaccinating against bird flu straight away. And we'll read a few articles about bird flu. But perhaps before we even start bird flu, let's cast our minds back to 2009 when there was a swine flu pandemic. So this article is on Wikipedia. It's on the 2009 swine flu pandemic page, and we're going to read accusations of conflict of interest. So in January 2010, Wolfgang Wodarg, a German deputy who trained as a physician, that's a doctor, it's another word for a doctor, and he chaired the health committee at the Council of Europe, so he sounds like a very important doctor, yeah, he was working for the Council of Europe. He claimed in 2009 that major firms, 2010, that major firms had organised a campaign of panic to put pressure on the World Health Organization to declare a false pandemic to sell vaccines. Let's read further. Wodarg said the World Health Organization's false pandemic flu campaign is one of the greatest medical scandals of the century. He said that the false pandemic campaign began in May 2009 in Mexico City, when 100 or so normal, in speech marks, reported influenza cases were declared to be the beginning of a threatening new pandemic, although he said there was little scientific evidence for it. Nevertheless, he argued that the WHO, that's the World Health Organization, in cooperation with some big pharmaceutical companies and their scientists, redefined pandemics. Okay, so they changed the definition of pandemic in 2010, according to Wolfgang Wodarg, and they removed the statement that an enormous number, you've got to say enormous number of people, amount of work, amount of money, amount is for uncountable nouns, number is for countable nouns. So an enormous number of people have contracted the illness or died. So they changed the definition and removed that statement, an enormous number of people have contracted the illness or died, and they replaced it by stating simply that there has to be a virus spreading beyond borders and to which people have no immunity. So the new definition of pandemic didn't need lots of people dying, okay? The WHO, the World Health Organization, responded by stating that they take their duty to provide independent advice seriously and guarded against interference from outside interests like Pfizer and AstraZeneca and all of those outside interests. Announcing a review of the World Health Organization's actions, spokeswoman Fadela Chaib stated, "Criticism is part of an outbreak cycle. We expect and indeed welcome criticism and the chance to discuss it." So that's good. They want to be criticised, the World Health Organization. The WHO also stated on their website that the world is going through a real pandemic. So they disagree with this a false pandemic. They disagree with the Council of Europe and with this doctor, Wolfgang Wodarg. Their medical expertise state that it was a real pandemic. So I want you to cast your minds back, guys, and think, was there a real pandemic in 2009? Because many of you were alive at that time, and you can decide who is telling the truth and who is lying. The description of it as a fake is wrong and irresponsible. In March 2010, the Council of Europe launched an inquiry into the influence of pharmaceutical companies on the global swine flu campaign, and a preliminary report was in preparation. Okay, we'll go down to this last paragraph. In June 2010, Fiona Godley, editor-in-chief of the British Medical Journal, you remember that's the journal that recently brought out an article stating that it's possible that COVID vaccines may have fueled the rise in excess deaths over the last few years. So it's that journal. Fiona Godley published an editorial which criticised the World Health Organization, saying that an investigation had disclosed that some of the experts advising the World Health Organization on the pandemic had financial ties with drug companies. They mean pharmaceutical companies, because pharmaceuticals are drugs, you see, which were producing antivirals and vaccines. Okay, interesting. Margaret Chan, Director General of the World Health Organization, replied, stating, "Without question, the British Medical Journal feature and editorial will leave many readers with the impression that the World Health Organization's decision to declare a pandemic was at least partially influenced by a desire to boost the profits of the pharmaceutical industry. The bottom line," and that means, the most important thing, the bottom line is your profits in a business, but you can also use it as the most important thing, however, is that decisions to raise the level of pandemic alert were based on clearly defined virological and epidemiological criteria. It is hard to bend these criteria no matter what the motive, no matter if there is a financial motive, like making more money. Okay, let's go back to that bird flu now. Let's go to the Forbes one. An ongoing bird flu outbreak among US dairy cows has led to three confirmed human cases in dairy workers. You can hear how many that is, guys. That's 3 cases. And although there aren't any confirmed cases of human-to-human transmission, experts warn safety measures like masks, vaccines, and safety goggles, that's what this guy's wearing, I suppose, will be needed if a pandemic is declared due to the virus's deadly nature. And here we have a picture of some poor bird being abused by a man wearing a face mask. Okay, key facts. The Centers for Disease Control and Prevention told Forbes it's monitoring human and animal exposure to H5N1 bird flu and watching the situation carefully, though the current public health risk is low. Well, 3 cases does sound pretty low. Although rare, bird flu typically affects humans who've come in contact with infected birds, and there aren't any confirmed cases of human-to-human transmission. Okay, let's get rid of that guy. I don't want to see him in the background. Let's just pause him. The virus may spread from animals to humans through airborne transmission and through contact with infected surfaces. Dr. Jessica Justman, and now we have an A positive, guys, an infectious disease specialist and epidemiologist at Columbia University, told Forbes, though the exact transition process isn't fully understood yet. It remains a mystery. However, former CDC Director Robert Redfield, who helped oversee the agency during the COVID-19 pandemic, told NewsNation earlier this month a bird flu pandemic is inevitable. Now, inevitable means there's no question whatsoever there will be a bird flu pandemic. So it's not a question of if, it's a question of when. Okay, interesting. So what are we going to need to do then about this bird flu pandemic? What safety measures may be put in place if a bird flu pandemic is declared? Well, experts have cautioned that if a bird flu pandemic is declared, safety measures will need to be put in place to mitigate the spread. Dr. Donald Bizanzio, a senior epidemiologist with the non-profit research institute, RTI International. So he doesn't work in a hospital, he works with the non-profit research institute RTI International, told Forbes that methods like masking and social distancing should be the first to be implemented. Now, I want to remind you all that social distancing is when you stay away, as far away as possible, from your fellow man, and you lock yourself away in your own home, and you don't talk to anybody, and you keep everybody as far away as possible. Now, I'm going to go over to a different article now. Loneliness can dramatically increase the risk of stroke. This is 25th of June 2024. Deadly condition is becoming major public health issue as people become more isolated, according to the latest data. The feeling of loneliness may dramatically increase the risk of stroke, a major study has suggested. The research by Harvard University in the United States found that such feelings could increase the risk of the deadly condition by more than 50%. Scientists tracked about 12,000 people aged 50 and over between 2006 and 2018. They found that those who had long-term feelings of loneliness had a far higher risk of suffering a stroke. Dr. Yenny Saw, the lead author of the Harvard T.H. Chan School of Public Health, said loneliness is increasingly considered a major public health issue. Our findings further highlight why that is. Especially when experienced chronically, our study suggests loneliness may play an important role in stroke incidence, which is already one of the leading causes of long-term disability and mortality worldwide. Okay, and this loneliness, if you go down to the bottom, if you read the whole article, you'll see that it's strongly related to blood clotting. Yeah, so it's blood clotting which is caused by this loneliness. And so it's not just the medicine which must not be mentioned which causes blood clotting, it's also social distancing, it's loneliness, it's isolation. Okay?